One of the factors that enables us to perform treatment so effectively in the liver is the use of contrast. Here, for example, is an HCC immediately after radiofrequency ablation, where we can see a fairly poor definition of the tumour. Here on CT, we can see preservation of a small area of enhancement indicating residual tumour. We can use this quite effectively with ultrasound contrast to control the effectiveness of our radiofrequency ablation and pick up quite small nodular areas and determine whether or not there is residual tumour which we need to go back and to treat. So in my practice now, ultrasound contrast is fairly routine in liver imaging, wherever we're trying to detect or characterize focal liver lesions, and particularly for controlling biopsy or radiofrequency ablation techniques. We can use it in the pancreas as well. And here is an example of exquisite visualization of a pancreatic tumor. This is the corresponding MRI slice, where we don't see the tumor anything like as effectively. You can see on the MRI there is some thickening of the duodenal wall. Here we see it on the contrast-enhanced ultrasound. This is the mucosa of the duodenum. You can see the layered pattern, which is enhanced normally. And this is poorly enhancing tumour invading the muscularis propria of the duodenum in almost a circumferential pattern. So we're seeing that really well, both anteriorly and posterior to the tumour. But here's the key finding on this scan. We can see a tiny tongue of tumour here growing out towards the enhancing superior mesenteric vein. And this ability to show the relationship of the tumour to the portal vein is vital in planning the type of surgery that we're going to perform for primary pancreatic tumours. And in studies to date, ultrasound contrast has performed at least as well as CT and MRI in staging primary pancreatic carcinoma and determining the vascular relations and degree of vascular involvement. Now, there's a large number of different research opportunities with ultrasound contrast, particularly when we're trying to study animal models. And one of the things that properties of ultrasound is that it can be scaled up or down very effectively in a way that is more difficult to do with CT or MRI. In our small animal imaging laboratories, we do have micro CT and micro MR scanners for studying small animal models, but these are extremely expensive. Yeah, ultrasound can be scaled down by increasing frequencies and by building special transducers. And here, for instance, you can see a Doppler study of a 2 millimeter tumor in a mouse, where we can enhance the Doppler study by contrast to pick up what is really microvasculature within the tumor and study the effects of things like anti-angiogenesis agents and see their immediate effect on tumor blood flow. Here you can see a mouse heart being studied with ultrasound. The mouse heart beats at between 300 and 600 beats per minute. This is far too fast to be visualized by CT or MRI, but ultrasound on this scale at least, which is less than a centimeter, has the ability to keep up with these incredibly high frame rates, and ultrasound contrast, as you see here, will not only demonstrate for us the chambers, but here you see bubble bursting, a high mechanical index pulse to purge the myocardium of bubbles. You can then look for reperfusion, and there you can see it occurring even on this millimeter scale. And this is translated into myocardial perfusion studies in man, where we can demonstrate the extent of infarcts really very effectively. We can also image selectively the microvasculature. If we're looking in the late phase, after the initial arterial input, bubbles get trapped in the small capillaries and microvessels of a tumour, and will very slowly pass through. In any individual scan snapshot, we may visualize a few of these small microbubbles, but we don't get a picture of the microvasculature as a whole. But if we have a very long persistence mode and some images in sequence, we can build up a gradual image of the full extent of the microvasculature. Here you can see the tumour, a necrotic centre, and multiple feeding and draining vessels in this small breast cancer. And this technique of microvascular imaging, or MVI, as some of the manufacturers call it, is extremely powerful in imaging structures such as the breast and the prostate. It can be applied to larger lesions in the liver, again looking at late phase imaging, looking at smaller numbers of microbubbles as they slowly traverse the lesion, so we can build up a pattern of both small and large blood vessels within the tumour and see exactly what is happening. So now, using these techniques, we're able to visualize with contrast ultrasound blood vessels of the order of 50 microns in size. And it's at this level of scale that we start to see the abnormal patterns of the microvasculature, which is tangled, chaotic development of vessels with blind-ending vessels, shunts, loops, and arcades that we don't see in the normal regular pattern of normal tissues, such as here in this renal cortex. So certainly, at least with animal models and with superficial structures, using very high frequency ultrasound imaging, we are now able to visualize a microvasculature. We can also perform perfusion imaging. If we give a high mechanical index pulse to burst all the bubbles will slowly perfuse into the imaging space from vessels around. And we can map regions of interest, and we can plot the arrival of these microbubbles with low mechanical index imaging and produce graphs of this type that you'll be familiar with from dynamic contrast-enhanced CT and MRI. And from these curves, we can derive numbers that will tell us how well perfused particular pieces of tissue are. We can derive perfusion maps or individual point perfusion profiles. This is also very useful in cardiology as well as in imaging of tumours in animal models and superficial structures. Now, there are a number of other applications of contrast-enhanced ultrasound that I don't have time to talk about. They can be used very effectively in renal imaging to look at tumours and characterize them, and also distinguish to a certain extent benign from malignant small renal tumours at least as effectively as we can with CT. But they can also be used very effectively for vascular imaging. They can be used to show leaks for endovascular aortic repair. You can detect pseudoaneurysms in pancreatitis very effectively. And you can even track acute bleeding from liver and spleen and abdominal trauma and show exactly where the bleeding point is. In fact, I've even treated a few bleeding lesions by direct injection of thrombin and fibrin tissue glue, having located the site of bleeding using contrast-enhanced ultrasound. So just as with CT, you wouldn't perform an abdominal CT without the use of contrast. Certainly we're getting close to the point where with ultrasound, if we have significant lesions or significant pathology to investigate, contrast-enhanced ultrasound is equally important as contrast in CT. But the research possibilities are continuing to grow. We've had difficulties until recently applying ultrasound contrast techniques to organs such as the prostate, partly because the high frequencies that we use for prostate imaging are not really compatible with the microbubbles that are available, but different size microbubbles, different composition microbubbles respond differently to different frequencies, and we're gradually learning how to do this. And we can plot different parameters such as arrival time of contrast in various points of tissue, and draw maps of the prostate, here showing that in this obvious small prostate cancer, we can see an early arrival time of contrast in the bulk of the tumour compared to the rest of the prostate. And this is important when we try to evaluate the effects of different therapies, medical therapies, on prostate tumours, such as anti-angiogenesis agents or anti-androgen therapies. Here is a simple power Doppler study of the prostate, enhanced by contrast to give us better visualization of the degree of vasculature. After several weeks of anti-androgen therapy, you can see that the vasculature declines dramatically, and a switching off of blood flow through the malignant areas is a characteristic feature of successful treatment of prostate cancer. So in Europe now, contrast-enhanced ultrasound is becoming a fairly standard technique for the evaluation of significant abdominal pathology, but is also forming a bigger and bigger part of research programs, particularly in oncology, particularly in the search for surrogate markers for the immediate effectiveness of new drug therapies. Thank you.